see government plan patients? And if so, why do you see them? And then how do you make it productive?
Okay, good question. In one way, I want to defer this back and say, talk to our team, we'll explain this one to you. But I do want to just tackle it generally. The answer is yes. In fact, we're the only office in our community that open the doors to government plans. You want to come here, we'll take you. With one Facebook post, I think we got, I don't know how many 100 patients came, okay? Because no one else would see them.
Right.
So the reason we saw them is because no one else would, period. It's the reason why when I do GA to this day, 8 out of 10 cases are healthy smiles.
Right.
They're not wildly profitable, but under GA they can be. It's one way. But the way that we dealt with it in general was to make it a more strategic schedule. So instead of sprinkling government plan patients all over the schedule, we just had dedicated days. And on that dedicated day, we would overbook, not to give poor service, but because the nature of the demographic, there were some openings. You have some people that don't come in. You have some people that it's, maybe it's one tooth kind of thing. And you have some people that need like 8 fillings.
Great.
And so we would just bring them in and give them the treatment that they were not getting. Because in the usual dumping ground for these patients is the emergency system, be it the hospital or the on-call dental system, which, by the way, both provide very needed and valuable services. But they don't have the time to properly deal with the patient's needs fully. They deal with the problem, the emergency. So we would bring these patients in, we would do a diagnosis, treatment plan, and treat it all right there. So they might be in the office for 2 hours, but we get it all done. And we would just be back to back, all day. People understand this concept because lots of offices do the free dentistry day. That's what we did. So instead of doing a free dentistry day, we did this. Was it profitable? Yes. Was it as profitable as full fee patients? No. But it was a service to the community that no one else was offering. So we would do one of those a month. It got to be 2 a month. I'm okay with that because we're doing so well. Why can we not use the skills that we have to help other people? Now, I could do a free dentistry day. That's fine. There's nothing wrong with that too. But you have this large section of the population that has any variety of, this alphabet soup of government plans, right? OW, ODSP, and blah, 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 blah. It goes on and on, right? But these people aren't being seen because their fee, it's not their fault that the program sucks and pays 50% of the fees. I get it. But as a result, dentists, and I understand why, say that, well, unless the government fixes it, I'm not going to see them. I understand because it's unprofitable. You're basically losing money to see them. I get it. But if you do it this way, it's profitable enough. You certainly aren't losing money, but you're serving the community in a way that no one else is serving. Side note to this is just because a person's on disability doesn't mean every single person they know is on disability. We've had many new patients join with good insurance plans because we helped a relative who was on disability, okay? So this takes a little bit of getting out of your own way and a little bit of, understanding that, it's like we used to say in our team meetings, the better our business is doing, the more good that we can do.
Right.
And it means, yes, giving money away financially, but also helping people with the services we provide. And I'm not saying that this was an unprofitable thing, that we actually weren't able to make any money at it. It was profitable, just not like a full fee day. However, it is still profitable. So yes, it can be done, and that's how we did it. So you're basically creating a more dense schedule, and you're just doing all of the needs that day. Every patient's booked 90 minutes and fill the day.
Super.
And by the way, double book it too while you're at it. Okay. So people have to wait a few minutes, it's okay. And you tell them when you book them, hey, you know what, we have some time on this day. It's a busy day, but we'll squeeze you in. And if you don't mind a little bit of waiting, and you tell them when they come in. And you have amenities, right? You have, we always had drinks and we used to have chocolate chip cookies, freshly baked, and we had all kinds of things for people to entertain themselves, the computers in the reception area and all these things. And people would be okay with waiting a little, right?
Right.
Plus they understand, 95% of people understand that nobody else will accept my plan.
Right.
And they don't have the means to pay for it anyway. So it's, if I have to wait 20 minutes, it's not going to kill anybody, right? So people are generally more acceptable of that.